I think different people are looking for different things in MS. I'm a clinician, a physician, and a clinician educator, and I work on trials. But I definitely think there are people out there looking for cures. We have people at Mount Sinai who are looking at that. There are people in all the major institutions that are looking for something really novel. I think we're going to see new data here at this meeting on remyelination and repair strategies, which we don't have at the moment, things that could reverse the damage done. It's not a cure exactly, but it's a whole unmet need. I think we're seeing data on that that's going to continue to change the course of this field in the years to come. Well, I think one of the benefits of working on trials is you get a really hands-on sense of what new medicines are like from the patient experience. And you can get a sense of that from the data, and you can get a sense of that from the publications, but there's really no substitute in my mind for having been there with patients while they got dosed with alemtuzumab in the case of the data that I'm presenting, or are treated for the first time with an oral medicine. We did some of the original FTY or fingolimod studies. I mean, patients getting a pill for the first time, it's meaningful. So I think that there is something to be said for that. I think it also gives us an opportunity in our center to give patients an opportunity to try things and to be in studies that could potentially benefit them, but definitely will benefit science. I think it's an interesting thing. Patients go into trials for lots of reasons, but I think the main almost psychological benefit is they've got a diagnosis, and that has impact for them. But now they're using that to contribute something beyond themselves. And that can be kind of empowering for patients in its own right. I think that MS centers are an important part of MS care. We attempt to provide really comprehensive care for patients and do things beyond what a practice that's not focused on that might be able to offer. But I think the good thing is there's been a lot of interest in MS. We run training programs for neurology residents that are considering a career in multiple sclerosis, inspiring people to do fellowships in this area, and there's certainly more of us now than there were a decade ago. So I think there is growth in our field, not just from the therapeutics, but from the treaters, from the people, and that gives patients more and more opportunities to have MS familiar neurologists. That said, I mean, as an educator, part of my job is to convey this information so that even people who didn't do the trials can know this information as in a nuanced way and use that in a modern way for patient care. The future is going to get more complicated, I think, before it gets easier, which is an okay thing. I think having a lot of options for patients is important because this is a very heterogeneous disease. We have a lot of different goals. I think in other diseases that take a very clear path, even a bad path, diseases like ALS and Huntington's disease. The goal is straightforward in a sense, what we're trying to do. In MS, it's broader. We have a lot of different manifestations. We have a lot of different treatment strategies, and I think we're going to be combining treatments and preventing worsening of the disease while hopefully adding a layer of treatment to build it back and remyelinate. So I think it's going to get more complicated and more personalized. We'll probably have a panel of biomarkers. There'll never be just one. A panel of biomarkers that we'll use to customize treatment. And it'll be more time consuming. Hopefully the medical field will allow for us to continue to take time with patients to make good decisions for them. But I think that's how it's going to look in the next 5 to 10 years.